Hi, Laura.
Hello. Hello. Good
Hello.
morning, good afternoon, and good evening to everybody. We will start in a few moments. Hi again, everyone. Good morning, good afternoon, good evening, depending on where you are. Welcome to all of you to this webinar. I hope you are all doing well and that you and your family are all healthy and safe. This webinar is hosted jointly by the Climate Investment Funds and the World Bank's Pilot Program for Climate Resilience team. So we are happy that you can join us for today's webinar. For those who do not know me, I am Lori Rufo. I'm the coordinator for the Pilot Program for Climate Resilience, or PPCR, of the Climate Investment Funds. I will be your moderator for the webinar today. And the topic for our discussion is climate services for good health, supporting climate resilient healthcare. So today we will be discussing a very important and a very timely topic, given the ongoing issues and challenges that we are facing because of the global pandemic brought by the coronavirus. So this is a very important topic that we will discuss because this greatly affects the most vulnerable population in our communities. And throughout the conversation with our speakers, we will reflect on the public health implications of climate change and the role of climate information services in making the health sector more climate resilient. And throughout the webinar, we hope to have a lively discussion and an exchange of good practices and raising awareness in supporting our climate resilient public healthcare systems in the developing countries. And so in this next slide, we are outlining here the agenda for today's webinar. So it will consist of a short contribution and presentations from our panel of experts and practitioners, which I will introduce to you later. There will also be a segment of open discussions where we will be inviting all the participants to raise questions and share your thoughts. And you can do this through the chat box in the WebEx application. And then we will close the webinar with a summary and concluding remarks from our colleague Kasi Fatiha Ahmed. She is leading the work of PPCR at the World Bank. Let me also mention to you that we have our PPCR team here. In this webinar, we have Hannah and Shanfu who can also help us if you have any issues with your technical connection. But before we move on our main topic today, I'd like to say a few words about the Climate Investment Funds and the pilot program for climate resilience for those of you who are not familiar with our program. So the Climate Investment Funds was established in 2008. It has a total funding that has reached US $8 billion. It is one of the largest fast-track multilateral climate funds in the world. CIF has a mandate to provide developing countries with a needed jumpstart toward achieving low carbon and climate resilient development. Currently, CIF is implementing 4 programs. First is the Clean Technology Fund. It promotes the application of low carbon technologies through investments in renewable energy, energy efficiency, and clean transport. We also have our Scaling Up Renewable Energy program, which is focused on low income countries. It improves energy access and accelerate economic growth by supporting the shift towards renewable sources of energy. And we have our forest investment program, which is supporting direct investments to address the drivers of deforestation and forest degradation by promoting sustainable forest management and livelihood. And the last is the pilot program for climate resilience, which I will discuss in detail in my next slide. Currently, SIF has more than 300 projects in its portfolio spread across 72 countries, and we are implementing these projects and programs through our partnership with the MDBs. Now, let me also inform you that SIF has established 4 new programs, and these 4 new programs include the Climate Smart Urbanization Program, where we aim to focus on small and medium-sized cities so that they can transition to low carbon and climate resilient pathway. We also have our Nature, People, and Climate Investment Program, which aims to improve the conditions of the rural communities and at the same time conserve the natural capital assets in the countries. We also have the Renewable Energy Integration Program, where we aim to support first-of-a-kind investment in enabling technologies, infrastructure, and other emerging innovations in the energy sector. And the last but not the least, we have our industry program, where we aim to catalyze deep behavioral change and sustain impacts in high-emitting industries in middle-income countries. Now, zooming into PPCR, the Pilot Program for Climate Resilience is our 1.2 billion program on adaptation and resilience building for the developing countries. Right now, we have 28 countries participating in the program, and we have two regions where PPCR is also being implemented, in Caribbean and in the Pacific. The PPCR program has driven pioneering actions and innovation on climate resilience by assisting our countries mainstream adaptation and climate resilience in developing planning and sector plan. We are also helping government establish standards for their climate resilient infrastructure and has also supported the first credit line to private sector banks so that communities and small and medium-sized enterprises can implement climate resilience projects. One of the core objectives of the PPCR is knowledge and learning. So that's why we are here today. We have organized this event in order to contribute to that objective. Let me also mention that PPCR has a 287 million funds to help countries improve access and investments in weather and climate information services. And these are across Africa, Asia, the Pacific, and the Caribbean. And today, I am very pleased to inform you that we have a representative from Jamaica joining with us as one of the panel members, and I will introduce you to her later. Now, with my greatest pleasure, I would like to invite our distinguished panelists for this webinar. We have Professor Chris Eby. Chris is the professor in the Center for Health and the Global Environment at the University of Washington. And we also have with us Dr. Joy Schumacher-Gilmont. Joy is leading the Joint Office of Climate and Health between the World Health Organization and the World Meteorological Organization, which is based in Geneva, Switzerland. We are also pleased to have with us today Dr. Stephen Dory. Stephen is a public health doctor, and he is currently working in the Health, Climate, and Environment Program of the World Bank. And last but not the least, we are honored to have with us today Dr. Nicole Dawkins-Wright. Dr. Nicole is currently the Director of Emergency, Disaster Management, and the Special Services Branch of the Jamaica's Ministry of Health and Services. Dr. Nicole is also the focal point for climate change in the ministry and the focal point for the vulnerability and adaptation assessment of the health sector component of Jamaica's PPCR. If you are interested in the detailed biographies of our dear presenters today, you can go to the SIF event page to know more. And so now we will start with the presentation of Professor Chris Eby. Chris will give us a brief overview of the key intersections between climate change and health, and will discuss some key areas of action. But before giving the floor to Eby, let me remind everybody to mute your audio and also switch off your video so that we can save our bandwidth for our WebEx connection. And when our speakers are presenting, I encourage everyone to feel free to use the chat box in the WebEx application to send in your questions and thoughts, and we will try to address some of your questions during the discussion session. We are also going to record this webinar and make the recording available on the SIF website. Okay, we'll hand it over now to Professor Ebby. Chris, you have the floor. You may start. Thank you.
Thank you so much, Lori, and I want to thank you and your team for all your work in putting together this important webinar, and thanks to everyone for joining. If we go to the next slide, I will start with a broad overview of the impacts of climate change on human health. In the middle, you can see some of the factors that are changing. Rising CO2, of course, is driving climate change, driving rising sea levels, and then we see resultant changes in temperature, more extreme weather, for example. Around that are some of the exposures that result from these changes in our environment that are important for health. Starting at the top, you can see air pollution, and it goes on around. Outside of that is a list, and it's not a complete list, of all of the health risks of a changing climate. For those of you who work in the health sector, you recognize that this is almost everything a Ministry of Health needs to deal with. Climate change interacts with the multiple drivers of all of these health outcomes. Climate change is a stress multiplier. And this means that climate change cuts across the programs and policies within a Ministry of Health. That when you look at these various health outcomes, all of them are problems today, but climate change is making them worse. So in one way, the sector is in a relatively good position compared with other sectors in that we are already dealing with these health challenges. On the other hand, all of the policies and programs were developed without considering a changing climate. So there's a lot of work that needs to be done to be able to incorporate climate variability and climate change into these policies and programs so that they can increase resilience as we move into a very different future. Next slide, please. One of the key ways for helping increase resilience to a different future is to build climate resilient health systems. On the left is a figure that shows there are 6 basic building blocks for health systems. Around that are 10 components that are really important for all countries to be able to build a climate resilient health system. On the outside of that are some specific suggestions of what needs to be done. All of these are taking place in some countries, not in all countries yet. On the right, on the outside, in the top green box, you see national vulnerability and adaptation assessments. These are often a first step for countries to understand their vulnerabilities to a changing climate. And importantly, in the context of our discussion today, to build partnerships with the national hydrologic and meteorological services so that you can start having deep engagement across all of the sectors that are relevant for health. That includes not just the meteorological services, also water and agriculture. From your vulnerability and adaptation assessment, you can gather information that will be useful for analyses in conjunction with your meteorological services. For example, develop early warning systems, which is listed right underneath. On the left-hand side, in a kind of turquoise blue color on the bottom, you see climate resilient water safety plans. That also means there needs to be engagement with the meteorological services to ensure that those plans take into account not just recent changes in our weather patterns, but what is projected over the next several decades. Above that, climate-informed risk maps for vector-borne diseases, a similar comment there. And I could go back to the previous slide and expand, and for basically all of those different climate-sensitive health outcomes, there's important ways that we need to work with the meteorological services to ensure that we are moving towards a more resilient future. Next slide, please. I'm going to use an example around vector-borne diseases because I know Joy will talk a little bit about heat. When we think about early warning systems, the most information we have from the health sector is around the efforts with heat wave early warning systems. For vector-borne diseases, I'm going to focus on dengue fever briefly. Dengue fever is carried by a mosquito called Aedes aegypti or Aedes albopictus. It is transmitted worldwide. There's estimates of about 400 million cases around the world. There are observations that the mosquitoes are changing their geographic range. We do know that there's been an intensification of cases, particularly last year was a very large increase in the number of cases. I'm not going to go through this whole figure, but the figure is here to illustrate, you see temperature and precipitation. The temperature and precipitation determine where you see mosquitoes, what time of year they occur, how active they are, and therefore how much transmission you can have of the various diseases carried by Aedes aegypti, including dengue. Temperature also determines the rate of replication of the pathogen. And so temperature is deeply intertwined with the transmission dynamics of this particular mosquito. Next slide, please. Because of this, there are ways to use environmental information. And these figures are an illustration of that. On the top, you see in the pink curve, that's traditionally what we have seen when we have outbreaks of just about any disease, that there's a ramp up, there's a peak, and there's a decline. And that has occurred throughout history. The red curve shows what happens when you have passive surveillance. You're not out looking for cases, but you have cases reported to you as people come in, for example, with COVID-19 or come in with dengue, that you have reporting of those cases. And when you have that reporting from passive surveillance systems, you can see that you can detect the first case earlier, you can implement a response earlier, and thereby reduce the size of the outbreak. The next figure shows what happens when you start using the environmental information we have access to. It's not been used as much as it needs to in the health sector, but we do have a lot of information that we could use. In this case, you start with forecasts from your meteorological services for the variables that are important for the spread of that disease. You have a passive surveillance system, and you start detecting cases very early. And then you can implement an early warning system with active surveillance, and you can dramatically reduce the size of that curve. The bottom is just an illustration then of how one goes about working with an early warning system in terms of monitoring environmental conditions through to implementing intervention strategies. Next slide, please. This is an actual case. This is from Singapore, which has historically had many outbreaks of dengue fever. And this shows a fitted curve between a model that was developed for using environmental information and the actual cases, showing a very good fit between the model and the actual forecast of when you would see outbreaks of dengue. What's not shown here is that environmental information is 4 months before the outbreak. That's 4 months to clean up breeding sites, 4 months to warn pregnant women, 4 months to undertake the kinds of educational programs that are needed. So it gives it a really advantageous, and sorry, having a hard time with my mouth this morning, having a long time period during which you can inform and prepare so that when the outbreak occurs, you don't have the number of cases. Next slide, please. Finally, I just want to make a reminder when we think about the health risks of a changing climate, almost all of those risks are in children. The estimate is about 85% of all the health risks of climate change are in children. So as we think about using environmental information using what we know about weather and climate to be able to forecast when and where we might have disease outbreaks. We're doing it to protect the most vulnerable. Thank you.
Thank you. Thank you very much, Chris. That was a very informative presentation, and we see a lot of similarities on how we need to approach climate risk management and also health risk management from your presentation, which I think is really very good. And now we move on to Joy. Dr. Joy will give us a presentation that will highlight from a global policy perspective the current status, challenges, and opportunities in developing and using climate information to manage health risks associated with climate variability and change. Please come in, Joy.
Thank you very much, Lori, and thanks to everyone for joining today, and many thanks to Chris for the great introduction. So as Lori said, I'll give a global overview on the state of play really for climate services within the health sector. So next slide, please. So as we've already heard in the great example about using climate information for dengue, we know how knowing how a changing climate affects when and where diseases and health risks are going to occur is really a critical piece of additional intelligence that the health community can take advantage of to better prepare and reduce the surprises that particularly climate extremes can introduce. So for example, with heat waves, we know that they are lasting longer, often hotter, and they're occurring more frequently in the last few decades due to climate change. But developing a climate service for heat really goes far beyond just using a temperature forecast for a public advisory of a heat wave. In reality, the co-design of a climate service, like an early warning service system, it needs to start far in the background by conducting impact analyses on morbidity and mortality, like Chris has shown the fit around dengue in relation to climate, establishing thresholds, developing indices and specialized data sets, developing and validating models, understanding the characteristics of when and why hot conditions or the climate hazard is going to occur in a region, how these extreme events can interact with other conditions like droughts and cyclones, and how urban environments can amplify heat conditions. We know that these issues all interact and cascade to amplify risks. And building an early warning system is also about partnering with many actors to understand how they're affected and why they need this information. So it's just to say that a significant amount of foundational knowledge needs to be developed and relationships need to be cultivated with many research and operational partners before we can just bring a climate service like an early warning system online. Next slide.
Joy, let me just intervene. I don't think we see you on the video. Would you like to turn on your video so people can see you?
I'm afraid it will reduce my bandwidth. I have very unreliable, so I apologize for that.
Okay, thank you, Joy.
Yeah.
No,
So what is the demand for addressing health and climate change? Well, looking at health in the nationally determined contributions is a good indicator. And here we can see that already 70% of the nationally determined contributions to the Paris Agreement as of December last year included considerations about health. 129 countries considered health. You can see these in blue. And this is particularly a universal concern for low and middle income countries, but not exclusively. So the inclusion of public health in the NDCs is very positive and not only increases national ambitions, but this is an important mechanism for countries to create more climate resilient health systems. However, we also see that very rarely do the NDCs relate health impacts of climate to the evidence or national policies. Only about 10% do. So next slide. So in order to take this critical step from making ambitions a reality, we really need to start with establishing an evidence base that can support policymaking. And doing this requires access to climate information and these are provided by climate services. So climate services really can be seen as an enabler of the entire adaptive policy process. And the World Health Organization conducts a climate change and health country survey shown here with the links down below. And amongst other things, this survey helps to monitor the use of climate information by ministries of health. And it's here we begin to see some gaps. So vulnerability and adaptation assessments are really the foundation of understanding adaptation needs. And of the 101 countries responding to this survey, only 50% have actually conducted a needs assessment. Next. And we start to see that the main priorities that countries report are not being funded in national adaptation plans. The top 3 activities are early warning and response systems, integrated surveillance, vulnerability and adaptation assessments, and research and knowledge about the impacts of climate on health. So these top 3 actions are all linked to climate services, and they form the basis of establishing this climate intelligence that we need for policymaking in the health sector. So accelerating funding for developing climate service in the health sector is really going to be a foundational element to building not only a better understanding, but also informing policies and building a stronger capacity for longer term adaptation. Next. Next slide, please. There we go. So additionally, at the World Meteorological Organization, we've also been tracking how national Met services are engaging with and providing climate services to the health community. And since 2017, the WMO report data that they collect from their members in the Lancet Countdown for Climate and Health. And what we've seen is that although engagement is increasing, in 2019, only 70 Met services report working with the health sector, and only about half of those are actually providing tailored products and services. So we also see that when climate services for health are compared to other sectors like water and agriculture, those in the health community are far less developed. So if we think back to 129 countries considering health in their NDCs, and yet only about 35 Met services are actually helping provide climate information, you can see that the health community really remains underserved. There is a long way to go in developing this capacity. Next slide, please. So why is this experience slow to develop? Well, there are a number of reasons, but very simply, I think it is important to remember that fundamentally climate services are the product or outcome of successful interdisciplinary partnerships. And partners need to be able to come together and work together to develop locally relevant, fit-for-purpose knowledge, an early warning system. So climate services really can't be developed by one sector or one partner alone. And we all know through experience that building partnerships and relationships can be very complex, requires time, investments in people, as well as institutional systems that are going to help build trust and enable success for this work. Next slide, please. So fortunately, we do have some guidance and good practice how to develop effective climate services for health. There have been many great examples from around the world for decades now. Even though this is an emerging space, the science has been developed for many decades. And I refer to this publication of 40 case studies, which also includes a framework and lessons for developing end-to-end climate services. Because through this project, we were able to learn and really
Hello,
common challenges and services. Yeah. So the 5 challenges.
Hello, Joy. Sorry, I think we lost you. We lost you for a while. If you can repeat the last 2 sentences, maybe.
Okay. So fortunately, we do have experience and some good lessons of how to develop effective climate services for health. So this is a publication of 40 case studies, which also includes a framework for developing end-to-end climate services, where we've been able to learn how these products and services and partnerships are being developed and really what's working to resolve common challenges that are sort of universally experienced challenges reported back from teams. And this starts with technical limitations, turning available data into reliable fit-for-purpose decision products. Data can be incompatible, lack of access to the data, data gaps, this type of issue. Secondly, is the ability to draw on and develop foundational capacities. And here, this can range from building skills in epidemiology and biostatistics to having enough computers and internet access, but as well as having institutional mandates and permissions that allow the sectors to work together and share data. Thirdly, teams report generating internal demand from leadership to include climate knowledge into policy and decision-making is still a challenge. Moving from pilot projects into a mainstreamed way of decision-making, taking advantage of that 4-month lead time that Chris mentioned. How do we do that in a systematic way? This is still very difficult. Next, fourth is that projects report not only securing funding is difficult, but really the concern is securing and maintaining the financial and human resources long enough to actually develop and provide a climate service. So for example, an early warning system might start in a 2 or 5 year project, but to become a fully operational system, we really need to have reliable and long-term funding, as well as staff in jobs and equipped to allow them to provide that early warning on a consistent basis. So it's not a one-time investment, and overcoming that barrier is really important. And then finally, communicating and translating climate risks is consistently difficult. And this often becomes a self-reinforcing barrier to some of the above issues if the value and limitations of climate knowledge, the uncertainties about this information, is not clearly communicated. So even though these represent a range of very complex issues, many of these barriers can be addressed through good program design and drawing upon the existing experience of what's working. So just to share with you and end with, I'd like to share a little bit of what WHO and the WMO are doing together and highlight some new opportunities to the hydromet community that you may not be aware are happening. Because although the two agencies have been partnering in the global framework for climate services for over 10 years now, some big advances have happened in the last year and a half. And notably, in 2018, the two organizations signed a new comprehensive agreement, and we developed an interagency work plan, showed here, to work jointly on issues of air and water quality, extreme weather, and climate services. And I think one of the unique things about this work plan is that it considers the joint support across the full value chain of integrated science, from the research and data needs all the way to the capacity building for applied services. It also focuses on urban areas and small island developing states, which are increasingly vulnerable to climate impacts. Next, and within the WMO, some really important policy steps have been taken to mainstream these actions into the hydromet community. So for the first time ever, the World Meteorological Congress passed a resolution to advance integrated health services within their new governance and technical structures. So they have just established last month a working group jointly with the World Health Organization on health under their Services Commission. The new research board has also established a tax team being responsive to emerging issues, that is looking at reviewing the science on climate meteorological factors related to COVID-19. We are also working with newly nominated health focal points at the National Meteorological Services. So for the first time, asking Met Services to designate responsible technical staff who can coordinate and respond to health needs. This is a big step forward and is a resource for everyone working in this space. And then finally, we continue to invest in user interface platforms, from focused topic networks like the Global Heat Health Information Network to Climate Outlook forums. And this year, we're building a new online climate and health science portal that's going to help health users more easily navigate and find climate service resources. So I'll end here and just say that there is a long way to go to develop this new field of climate services for health, but there are plenty of opportunities to strengthen the working relationships between the climate and health communities for climate resilience. So thank you very much.
Thank you. Thank you very much, Joy, for that very rich presentation. I think our participants will really appreciate how you have laid out all the challenges in terms of how the health sector and the meteorological agencies and also with W and WHO can work together. And it's also good to know that there are some good practices available out there where the countries can learn from. And as you said, while there is big progress in this area of providing information and climate services so that the health sector can be more informed, there's a long way to go. And but there are also big opportunities in the future on how we can improve partnership in the work. And now we're going to the presentation of Dr. Stephen Dory. Steve will share with us the perspective on the financing and the programming within the context of the World Bank initiatives on health and climate change. Please come in, Steve.
Thank you for the introduction, Loretta. Good morning, afternoon, evening, everybody. Thanks for joining us, and thank you, Chris and Joy, for the presentations before me. So, as it's been explained, my name's Stephen Dory. So I work in the World Bank in the Health, Climate and Environment Programme, which is part of the Health and Nutrition and Population Global Practice. So the part of the World Bank that covers health. So I'm going to cover the support that our team gives to our colleagues in the bank, but also to the client countries that we serve, to kind of contextualize some of what we've heard already and see how this can practically work in a large IGO such as the bank. I'll just preface by saying we're a new but growing program, and the fact that we exist reflects the increasing recognition of the links between the health and the climate fields. So if we go on to the next slide, please. My first slide. Thank you. So our mandate from the health within the climate field is driven by our World Bank global commitments. Just to note, my team also covers the other aspects of environmental public health threats. And I highlight this because we seek to give a coordinated and integrated approach. So we also touch on aspects of air pollution and water and so on, which do interact with health. But back to climate. The key document really that is our mandate here is the World Bank's Climate Change Action Plan, which is reflected here with the updated targets, which cover the period for the next 5 years. This makes use of the mandate offered by the NDCs, and as with much of the bank's approach, as a cross-sectoral organisation, seeks to leverage the resources and build on partnerships that exist to make maximum impact in this. The first step that the bank took here was to screen all of our operational work. So operations are the work that we do with countries to affect change. To screen all of this for climate and disaster risks. And we're now screening 100% of those. Building on this, the bank has also a program of climate co-benefit assessment. This is a multilateral development bank overseen process where all the financing is assessed for both adaptation and mitigation co-benefits. I just want to highlight not to confuse where the bank talks about climate co-benefits with health co-benefits. This is a different thing. This is where we're looking at the funding that is moving through the institution. How much of that can be argued to benefit either adaptation or mitigation priorities, as well as the work that it's done. It's intended for. This is an important process, and the reason I highlight it is for threefold. Firstly, it's mandatory for our teams in the bank to do this. So this has a really important advocacy and awareness raising function across all sectors. So this is not just health, but it has this function within health. Secondly, it enables the bank to track the proposed climate code benefits of the money passing through, and we're talking about the data here. If you can't see, then you don't know what you're doing. So that's a very key point, I think. And it also, probably the most important thing, is it actually leads to real change in these projects, to real increases in funding for climate positive interventions. So when this was first introduced, it was almost it was a way of like understanding how these things would influence climate impacts from the work. But the targets that you see on the screen, they increase each year, and so as we move forward, it becomes harder and harder for us to approve a project unless it really has increasingly strong climate benefits, whether that's through adaptation or mitigation. In the context of the work that I do, obviously that's through health. And then the final bullet here on the slide is that the climate code benefits, whilst they're great and a great innovation, they are process driven. They measure how much of the money that's going in is intended to go towards these impacts. They don't look at the outcomes. So starting from next year, the bank is incorporating at least one, ideally this will increase to more, climate related indicator in all projects with over 20% climate co-benefits. And as I was talking about the increasing targets for those climate co-benefits, in effect, that means that all projects will need to have these indicators. And this will have added benefits for generating further data within our institution. So if we can go on to the next slide, this looks at how we organize our response to this. And apologies for the small text on some of these, but I'll explain it through. I'll explain through this. There's really three main tracks. There's evidence generation, policies and strategies, and lending operations. I'll just stress a few things here. So under the evidence generation, there are two main kinds of assessments that we see as important. The climate and health vulnerability assessments, which we've already heard be spoken about. We think these are really key, and where they're needed and where the bank can help with making sure that these happen, we are keen to support that. But we really see, we are a bank at the end of the day, so we see a real addition that we can make here in climate and what we're calling climate and health economic assessments. So these would be based on or performed in parallel with climate and health vulnerability assessments, and they would model the costs and benefits of various policy options, including business as usual. We see there's some work to be done on looking at the population attributable fractions to do with certain health conditions when you're itemizing things in this way. They're an operation level as well as a country level angle to this. We're talking mostly here about adaptation and resilience, but just to note, the bank, we're also within our team, we have a work stream looking at the carbon footprint of the health sector. Now that may seem strange to be thinking about that in the lower and middle income countries where maybe the carbon footprints are not as great as in some of the higher income countries. But if our aim is to move to global access for universal health coverage, that's done at the same carbon intensity that we see in the higher income countries, then we're really going to be in trouble, and we're not going to we're not going to provide that health to people because climate change will prevent it. So we see this as an important part of the work that we do. In terms of the policies and strategies, so the NDCs, of course, is an important mandate for us moving into this space, and the key here is that this is coordinated, and within the bank there has been the NDC support facility, which coordinates all of the different sectors, including health, and that works through the NDC partnership. Moving forward, this will come under something called the Climate Support Facility, which is really going to be key for scaling up and coordinating the financing here. And what's going to be really important in this is that the support that currently exists for what we call sustainable development sectors, so things like water and energy and environment, that is maintained. But within the bank, we also have other sectors that we refer to as human development. So that includes health as well as social protection and education. And I think, as Joy was alluding to, they've been relatively had less focus on than perhaps these more primary sectors, and it's going to be important that as we move forward that balance shifts. We also we're looking at how this moves then into the health aspects of national adaptation strategies and action plans. We also did an internal review of the NDCs, similar to what Joy spoke about in her presentation, and exactly the same results. Many countries, particularly the lower income countries, recognize the vulnerability that the health sector has to the impacts of climate change. Equally, a large number of countries recognize that this is an adaptation priority, but much fewer, had any kind of plan in place. And then when we looked at mitigation, it was quite sparse in the health side of things. So that's something that we will be working on there, and we can do these as standalone health and national adaptation strategies, but we feel that they're better to be integrated with a wider country level plan, as well as across the whole of the health sector. Then in terms of lending and operations, so listed there is the climate co-benefit support that I've already spoke about, and as mentioned, as this program builds, this will lead to mainstreaming of climate across the whole field, led by health, but remaining integrated. And this there's a few examples of some of the work that we do there. This is both in adaptation and mitigation, as I said. So if we can go on to the next slide, this just kind of touches on some of the how some of the climate data and services we use in our day-to-day work. So key again is the climate and health vulnerabilities and economic assessments, and how these source information both from the hydromet as well as from the health sector, which may not be collected primarily for a climate reason, but there's also the whole of government data. So emergency planning, transport, energy, and most importantly our communities. Some of the services that we employ and we recommend our teams use day to day. So we have the climate and health vulnerability rating for each country. This was based on the ND gain, as well as the human capital index that we hold at the bank. I've already mentioned the climate and disaster risk screening process that we have, and the climate co-benefits. The resilience risk rating, which includes the economic angle and will be vital to the climate and health economic assessments, is something that's in development. I mentioned the carbon footprinting. The final piece here, just a mention of one of the more operational uses of data that we've had. This was in Georgia, in the Caucasus Mountains region, and this was looking at the social costs of temperature to do with housing. provided input from the health aspects, and this was working with the London School of Hygiene and Tropical Medicine in the EU to really look at where the costs would fall from both cold weather but also from heat waves. And this is a very powerful argument that we can then take, not necessarily targeted at the ministers of health, but the Minister of Finance and higher up that really allocate those budgets. Then moving on to the final slide, I was asked to mention how this all links to COVID-19, because of course this has been the main, almost the only event of this year and the last few months, certainly, even postponing the next COP. And the bank has been central to the real world response to this. Just through the health global practice, 12 billion US dollars has been committed for the initial emergency response, and over the next 15 months, up to 160 billion, of which 50 billion will be allocated, will be provided, and this will be tailored to health as well as economic and social protection. So this is like really quite a large investment. It's important because of the size, but the other important thing is that this money won't be spent on other things. So it's important we make sure that we are aware of the links between climate action and what's happening here. As an all-government organization, the bank's well placed to make these links between this and obviously the other global crisis, the climate crisis. And there are many links, many threats, but also opportunities, and it's key that we make the most of these and ameliorate the threats. So as you can see in my slide here, the bank has a long-term view, looking beyond just the immediate response to the sustainable recovery, and then leading beyond that into the transformational growth, if you like, the new normal. If any of you are playing word bingo, I've said it now. However, this is obviously an emergency demanding immediate response, and just to give a flavour of that here, the table represents the MPA components. Now, the MPA is the multi-phasic programmatic approach. This is kind of the template that the bank has been using with its operational support to countries, and it lists a number of actions that teams might want to take when advising countries. And each of these have potential adaptation and in many cases mitigation impacts. Eventually, all of these projects will be, this is where the 12 billion is going, will be assessed for climate code benefits. And this will allow us obviously to analyze how the response worked, but it will also be important in this initial phase to influence the adaptation and mitigation aspects of this very fast moving mobilization. So it allows us to break this down. What you can see on the screen there is just a flavor of some of these. I think that's my last slide. So thank you very much for your attention, and I look forward to the questions after the talk.
Thank you so much, Stephen, for that very good presentation and sharing with us the bank's work on climate change and health. And we are happy to note that the bank is working on this joint climate health and vulnerability assessment, which I think is good progress. And good to know that there's also the bank's emergency response on COVID-19 and relating it to long-term resilience and long-term sustainable growth. Thank you so much, Stephen. And last but not the least, we have with us Dr. Nicole. Dr. Nicole will basically round off our discussion and panel contribution by giving and sharing with us her firsthand experiences and deep insights on the work of Jamaica in mainstreaming health and climate resilience. Over to you, Dr. Nicole.
Thank you very much. Morning, everyone. Afternoon, I gather, and good evening in some places. Let me start off by acknowledging this awesome representation, including my fellow panelists, as well as to underscore the importance of this series that support enhancement of climate resilience that are co-organized by the Climate Investment Funds, which aims to raise awareness on this critical issue and to identify possible priorities by relevant partners. I must state that I am, in fact, honored to be invited to bring the perspective of Jamaica, which is among the group of small island developing states who are at the front line of the world's most vulnerable countries to climate change and one of the PPCR countries. So over the next 10 minutes or less, as panelists on the Knowledge for Resilience series, I aim to use the Jamaican situation of current practice, lessons learned, and challenges and priorities to provide aspects of the perspective. I hope to draw on the points of the preceding panelists to contextualize the operational aspects of developing and applying climate data and services, and in so doing, present how interventions support the development of climate resilient public healthcare systems in developing countries that uses the WHO's 2015 operational framework as a basis for building such systems and highlighting some areas whereupon further actions can be taken. Slide. Next slide. So Jamaica, along with other small island states, SIDS, has recognized the disproportionate vulnerability to climate change, being on the front line for what is the full range of acute and long-term risks of climate change. These include more extreme weather events such as floods, storms, and drought, increased risks of infectious diseases that are water, vector, and foodborne, increased risk of non-communicable diseases, and a threat due to sea level rise to relatively fragile healthcare facilities, given that they are almost exclusively situated in coastal areas. I must reiterate for emphasis that the additional stresses presented by climate change, combined with the existing challenges of communicable and non-communicable diseases, have obvious health risks with high morbidity and mortality. Health is a very complex issue that is affected by diverse factors. Climate change weakens the environmental determinants of health, such as clean air and water. Sufficient food and adequate shelter can increase the risk of extreme weather events. Climate action, however, has many health co-benefits across the spectrum of diseases. Jamaica is small, but climate action or inaction will affect Jamaica's estimated population of about 2.9 million people. Jamaica is particularly vulnerable to the mounting threat of climate change in the Caribbean region due to its geography and socioeconomic status, and this tends to be similar for other SIDS. Given Jamaica's development pattern since being constituted as a nation over 50 years ago in 1962, over 60% of the population live within 2 kilometers of the coast, and as a matter of necessity, critical services are established within capitals of these communities, including major health facilities. Some 80% of Jamaica's GDP is generated by Jamaica's vulnerable coastal areas, not least of which is the tourism sector. Climate change therefore causes impacts that are diverse and include environmental changes that give rise to direct health effects with increased disease burden from injuries and trauma, or as a result of disruption of services from extreme weather events, floods, droughts, and cyclones. There are also indirect effects such as the increased burden of climate-sensitive diseases, particularly those that are, for example, mosquito-borne, such as dengue, malaria, those related to the provision of water, diarrheal diseases, and poor air quality that is conducive to the transmission of infectious acute respiratory diseases, including COVID-19. There are also social impacts as a consequence of population demographics, where there are subgroups that are even more vulnerable. In Jamaica, for example, according to Jamaica's Health and Lifestyle Survey, over 46% of households are women-led. There's significant presence of informal or squatter settlement communities that render them having inadequate services. There's limitations of health services to cater to what has become characteristic within SIDS, termed the triple burden of diseases, chronic diseases, injuries, and trauma, emerging and re-emerging infectious diseases. There's the impact on the shelters on the built environment in terms of based on the location of communities on the coast, events that cut off rural communities are usually located in hilly terrains for which critical services may usually be insufficient in routine times, and this limitation is amplified by changing weather patterns that are much more diverse. And of course, the adverse weather events disrupt economic stability and increase dependency ratios within the population. Jamaicans, much like other states, however, where our populations tend to have an indomitable spirit, I might add. Therefore, we strive to preserve our states and deliver our obligations on the global agenda that is within our capacity, while also being quite active in attempting to secure recognition to maintain awareness and present ourselves for support, recognizing that there are severe and urgent threats to health and well-being of the people within SIDS that goes beyond our innate capacity to manage. We are therefore quite grateful for many platforms such as these and others such as the Conference of Parties to the Convention, where WHO launched a special initiative of climate change and health in SIDS, resulting global plan of action to provide overarching support needed to deliver on the regional plans of action, as well as to contribute to the delivery of sustainable development goals, particularly Goal 3, which aims to ensure healthy lives and promote well-being for all, Goal 13, taking urgent action to combat climate change. Jamaica is an active stakeholder in the Caribbean Regional Plan of Action for SIDS, allowing for continued action to strengthen experience and operational mechanisms. And as such, there are existing programs that serve to reinforce the 4 strategic lines of action that are tailored for the respective regions: empowerment, evidence, implementation, and resources. And so there are steps that have been taken to incorporate the support for health leadership that engage nationally and internationally. We'll eagerly look for intervention to enhance evidence generation that builds the business case for investment, and whenever possible, we accept whatever support can come to accelerate implementation of preparedness activities for climate risks, adaptation, and health promoting mitigation policies, and anticipate resources that aim to organize our system to facilitate access. It seems, however, that despite major strides, we are challenged to keep pace with the increasing demands of changing world produced by climate change. Next slide. Next slide. Yeah. The current situation with climate-sensitive diseases, such as dengue, illustrates the point. Over the years, a critical lesson for Jamaica has been the importance of a robust national surveillance system, which in our context is managed by the National Epidemiology Unit of the Ministry of Health and Wellness. This was established in Jamaica in the early 1970s, and dengue, recognized in Jamaica since before the first recorded outbreak in 1977, has been reported on by the NEU since 1990 and allows for documentation of the pattern of diseases. This pattern has allowed for planning that includes sequencing on disease control measures that's based on the seasonality that tends to follow weather patterns. The Meteorological Services of Jamaica, Met Office, a beneficiary under the PPCR, has however reported that the once predictable seasonality over the last decade has actually become much less predictable. Jamaica, falling within the Atlantic hurricane belt, had tended to experience the effects of storm systems during the hurricane season that is defined as June 1 to November 30 each year. However, it has been noted that cyclone activities have more frequently extended outside the usual hurricane season, with more frequent intense storm events. There are more intense periods of rainfall. There has been a change in average temperatures, with some of the highest temperatures being recorded over the last 2 years, and there are more extended periods of drought. It is therefore not surprising that the NEU has indicated that the pattern of mosquito-borne diseases has also changed, and is proposing, for example, to redefine Jamaica as being hyperendemic for dengue. For dengue, there's been a reduction in the period separating outbreak cycles from 5 to 7 years in the past to what we're now seeing as between 2 to 4 years, and these cycles tend to be associated with dry spells. It is also noteworthy that 2 emergent diseases in Jamaica, chickpea and zikpea, is also mosquito-borne by the same vector as that which causes dengue. There are other climate-sensitive diseases that are routinely reported on, for which the NEU processes, including zoonosis such as leptospirosis, an important differential to dengue, and acute diarrheal diseases in children under 5 years old, and not least of which is the acute respiratory illnesses such as influenza-like illnesses, and now the ongoing pandemic due to COVID-19. However, in spite of the progress in data management by the National Epidemiology Unit, it is difficult at this time to further illustrate the correlation and the link between events such as hurricanes and their probability to the incidence and or occurrence of disease or outbreaks, as there is a persistent challenge due to the scarcity of some critical data in a manner which is easily manipulated and with variables in time series for analysis. Nonetheless, if we look at other disease patterns over the years, a pattern related to hurricanes, for example, is the overall increase in burden of disease in hospitals within 2 months of such events, as compared to the same period in the previous year. The capacity to further refine health information for the purpose of planning and policy and planning has been augmented with the establishment of a research and development arm within the NAU. It routinely produces a research agenda in collaboration with the University of the West Indies. The most recent agenda, fortunately, has now included climate change and health as a priority. This will better position the Ministry of Health and Wellness in Jamaica to incorporate climate data and services to manage the additional risks of climate change and health, to improve planning and decision making in the health sector that has come with the enhanced capacity of the Met Office, courtesy of the PPCR. Next slide. It is also not uncommon within SIDS that the health system is in a near constant state of response at various levels of activation of the Health Emergency Operations Center. As such, another best practice has been the structure of the disaster management program in country, wherein the Ministry of Health and Wellness chairs one of the committees of the National Disaster Risk Management Council, for which the National Secretariat is the Office of Disaster Preparedness and Emergency Management, the ODPEM, the ODPEM. The Secretariat for the health sector is within the program that I direct and thus has a direct line of budget. Within this program is another sub-program, the Disaster Risk Management Sub-Program, which coordinates program activities for climate change action in health, including for floods and other weather events. There are established standard operating procedures that are updated annually and reported on as part of the annual calendar event, the launch of the hurricane season. In this launch, the Met Office provides the outlook for the upcoming season. As Program Director, I am the designated climate change focal point for the Ministry of Health and Wellness, and therefore a member of the recently established Climate Change Focal Point Network by the Climate Change Division of the Ministry of Economic Growth and Job Creation. This division is a government agency with the mandate to exclusively lead climate action in country and is responsible for articulating Jamaica's position in relation to climate action in accordance with the UNFCCC. The Climate Change Focal Point Network allows for a mechanism for sustained critical partnerships among and across ministries, departments, and agencies in both public and private sector, and include non-governmental organizations. Jamaica was still responding to a protracted outbreak of dengue in 2019 when the COVID-19 outbreak started in Asia. As the National Epidemiology Unit also conducts routine surveillance on acute respiratory illness, the system was in a good position to align the response to the WHO alert of a novel coronavirus that causes acute respiratory infections to its existing mechanisms. The response was therefore guided by a pre-existing pandemic influenza plan, which was adapted to produce the COVID-19 plan for Jamaica. A part of the response entailed an acceleration of the development plan for the Health Emergency Operations Center, with upgrades that include technology enhancements for information management. This has therefore placed the Ministry of Health Disaster Risk Management sub-program in a much better position to incorporate climate services into routine day-to-day operations. Hurricanes have formed unforgettable part of the nation's history because of the impact on lives, lands, and infrastructure, among other things. The associated displacement caused by hurricanes occurs in various ways, including through destruction of property, isolation from care, loss of family, and family destabilization. As we now enter the recovery phase of the disaster cycle for COVID-19, and with the commencement of the hurricane season, an important consideration, for example, is shelter management. As part of the response to the ongoing pandemic, there must be several adjustments, including the approach to shelter management. The adjustments are being done as a partnership between many entities, not least of which is the Ministry of Health and Wellness and the ODPM, with standard operating procedures for all phases of shelter management, be it pre-activation, activation, deactivation, and post-activation. The COVID-19 experience has served to underscore the importance of adherence to the basic principles of the primary care model for health service delivery, the foundation for efficiency in health systems in SIDS, where prudence and resources for health service delivery is critical, including the maintenance of sanitation standards, highlighted as critical to reduce exposure to infectious diseases and containing spread. Among the most critical lessons, though, is the importance of sustained and ongoing education training program and a risk management approach to all events that incorporates the Build Back Better strategy, so that with each event we are transformed for better resilience. The capacity to respond to climate change adaptation strategies has seen the need to improve capacity through training and partnerships at all levels among the healthcare system. It underscores the need for targeted interventions that can be provided by the climate information and data. Next slide. Jamaica is among
Dr. Nicole, if I may just intervene, because I'm just mindful of the time. Grateful if you can wrap up your presentation in 2 minutes, so we have time for discussion and Q&A. Thank you.
No problem. Among the several Caribbean countries undertaking regional initiatives to combat climate change, the development of the HNAP places emphasis on the vulnerability and adaptation assessment. Detailed assessments and costed plans will emanate from 2 projects. The VNA of the health sector by the PIOJ Strategic Program for Climate Resilience, which focuses on the health infrastructure through the ICDIM. And for Jamaica, this is a partnership between us and the World Bank through its implementation. And under this program, the activities will provide the assessment of the vulnerability of the health sector, determine the degree to which the sector is susceptible, identify the extent to which coping mechanisms are in place, and propose initiatives to build resilience. It will therefore build on the community level risk ranking published by the ODP and more recently the health vulnerability ranking updated as part of the COVID-19 response. The importance of this information is easily anticipated, and we look forward to several issues related to the VA. Next slide. So moving forward, and in considering our relation to climate change and health, I must highlight at this point that Jamaica is one of 6 Caribbean island nations participating in the regional PPCR program. It's a project for improving the quality and accessibility of climate information services. Under the PPCR, the adaptation program and financing mechanisms for the PPCR, financing water adaptation, the ICDIM, and promoting community-based resilience in fisheries sector. There are good governance instruments that allows for the acting on the imperative, including being party to the Paris Agreement, or National Energy Policy, which informs the Jamaica NDC, or Regional Action Plan for Climate Resilient Health System, part of the WHO plan, and a Disaster Risk Reduction Program 2016 to 21. Several progress has been made, or SMART project from the PAHO development, the PAHO project. The other projects, including the PCJ's Energy Management and Efficiency Project. And there are others that we can have insertion points for support from various entities. I end here by saying that the health sector, long recognized as a vulnerability issue, is now recognized as a mitigation issue. And it is therefore a part of adaptation planning, one of the sectors that must have dual actions for climate change in health, including leveraging the health co-benefits of climate action. Actions must therefore seek to, among other things, upskill and train staff. Technology needs to support future planning and improve stakeholder relationships, strengthen local systems to conduct and update vulnerability and risk assessments on a regular and ongoing basis. I thank you.
Thank you, Dr. Nicole, for sharing that very rich experience in Jamaica and emphasizing on the importance of conducting climate and vulnerability assessment, and how it is important to have this good collaboration between the health sector department and the meteorological agency in trying to come up with a good strategy on how to address some of the public health care issues and also issues on the public health systems. So now, so I would like to thank all our panel speakers, and we will now proceed with a number of questions that were posed by our participants. I think 2 of those questions are directed to Joy. Joy, there is this question. I have 2 questions for you from our participants. One is that the question is from Raju Sapkota of Nepal, asking how the action plan 2019 to 2023 is working to develop climate resilient green recovery plans after COVID-19 in the least developing countries. There was also a question where it is asking how WHO is working with the civil society to address climate health related challenges. So you may want to share your thoughts on that, Joy.
Certainly. Thanks so much for those great questions. So firstly, on the joint work plan, that was first developed several years ago, 2 years ago now, before the COVID-19 situation. But certainly the activities that are included in that work plan, which bring the two agencies and then by default the national Met and ministries of health that each agency work with, are certainly reinforcing to the kind of actions which are needed for a green recovery. And this includes data sharing on air quality, the research collaboration that I mentioned. We're having a new task team come together to look at the state of science on the potential environmental factors related to the COVID-19 outbreak. So just by having those foundational mechanisms for research review is very important. And then, of course, we have technical networks, one which is on extreme heat and human health. We've just produced a guidance on how to adapt heat action in the context of COVID-19. I can share those resources if anyone is interested. And then I have colleagues at the WMO who are also working on climate services for the energy sector. And so we know making renewable clean energy available to health services is a really important part of that green recovery. And climate services for those other sectors are also going to be very important. But I'd like to mention that WHO have also issued a manifesto for a green recovery. And they have a 6-point plan. This is on the WHO website. And it's pointing to issues of how we can lessen environmental impacts, ensuring clean access to clean water and energy, promoting the clean energy transition, sustainable food systems, healthy livable cities, and reducing subsidies for pollution and fossil fuels. So WHO have been very active in the green recovery process, and the work that we do together certainly reinforces how we can bring that into a climate resilient framework. So then to the second question regarding the role of civil society, again, answering this on behalf of WHO, since I wear two hats between the organization. WHO have a long history of working with civil society organizations, particularly on advocacy and awareness. They have actually recently, even every year, there is an annual summit of civil society organizations with the WHO. And actually 3 years ago now, they have formed an alliance that is called the WHO Civil Society Working Group to advance action on climate change. This can also be found on the WHO website, where a broad number of global organizations have come together for united messaging and activities on climate and health. But the role of civil society also is really essential at the country level, because NGOs are key stakeholders in national projects. They're often providing technical support directly to communities. Civil society are really essential interlocutors for rolling out climate adaptation and mitigation at the national level. So national civil society partners are absolutely critical.
Thank you so much, Joy, for responding to that question. And I think we also have one question. I think this is directed to Stephen from the World Bank. The question is, how can we know the current initiatives and how to participate to the proposed and participate to propose some of the current solutions? I think the question, Stephen, you may want to briefly comment on that.
Yeah, thank you very much, and thank you. The presentation on Jamaica was very interesting. I really enjoyed that. So, as I said, we're quite a new program, and we are developing a kind of a rollout of a number of workshops in the climate and health field. We've got an e-module coming out, which is fairly interactive as well. Along with that, we will be. Oh, hello, somebody there?
Go ahead, Stephen, we can hear you.
Okay, good. Along with that, we will be developing a more interactive approach so that we can get participation from the country level in that, and I'll need to follow up with further details on that at the moment.
Okay, thank you. Yeah, thank you so much for that, Stephen. And for that particular question, Stephen can also answer more in detail through email. Yeah.
And Loretta, please, I didn't include my email address in the presentation, which is an oversight, but please feel free to share that to anybody and I can follow up.
Okay, yeah, thank you, Stephen. Yeah, we will do that. And we have a question here from one of our PPCR country representative from Zambia. This is from Chitembo. She would like to ask Nicole, based on the Jamaica experience, Chitembo is asking if you can elaborate how Jamaica is planning its human resource development that will respond effectively to climate resilient and health impacts.
Thanks very much for that question. I must say, to elaborate on it, it is multi-sectoral and multi-pronged. Jamaica has incorporated a climate change and climate series at all levels of education in school, the mandatory schooling, primary school and secondary school, and there is now a module as an option in our tertiary level education. Additionally, across the sectors, we now have a mandate, certainly in public sector facilities, where in-service programs must seek to guide training of our human resources for climate change. With the focal point network, for example, that forms up a point of insertion for dissemination of information that's standardized across entities so that there's a standard approach to climate resilience across sectors. And as you know, all sectors impact on health. So there is a formal structure in place that trains the population from very early in terms of our formal schooling, and during professional setting, there is in-service programs that has an arm that looks specifically at training, in-service training for climate resilience that seeks to develop the workforce for climate resiliency across sectors, including health.
Thank you. Thank you so much, Dr. Nicole. And I received one other question. I think this is directed to Professor Chris. Chris, the question is that with relation to the challenge that Dr. Joy has presented, which is associated with translating and communicating climate-related risks to human health, what do you see are some of the good practices in translating some of the research results and insights on climate change impact and vulnerability for the sector into actionable climate resilient public health practices? If you could share with us your thoughts on that.
Thank you. That's an excellent question. And this highlights an area where there's lots of opportunity for additional efforts. I'll step back for a second and make a comment that in the health sector, the research to operations links are not always as strong as they are in some of the other sectors. It's an area where more work can be done. And what we have learned about being able to strengthen those links has come through adaptation funding, the kind of funding that's being used in PPCR to advance country resilience. And when you look back at some of the projects that were funded, Stephen talked about one in Georgia that is strengthening links between health and the meteorological services. There were multiple efforts under an early project funded by the Special Climate Change Fund across 7 countries, where those links were strengthened, early warning systems were developed. For example, in Uzbekistan, Bhutan, and in Kenya. I'm sure I'm forgetting some that were done. There was an extensive program developed in China on heat wave early warning systems in 4 cities that integrated everything from work to more education to involving both healthcare and the meteorological services. Joy did mention a document that has a number of case studies of ways that climate services have moved forward in particular settings. Hopefully that will be useful and will be a source of some good ideas. And overall, going forward, it's an area where there is rich opportunity to advance our understanding of what are the best practices, so those could be shared more widely. Thank you.
Thank you. Thank you so much, Chris. I think we came to the point where we need to wrap up on our discussion. And so I want to ask Kazi to please come in to provide us a summary and some concluding remarks for everybody. Kazi, please.
Thank you, Laura, for the opportunity. First of all, I would like to thank the speakers for the information that you all have shared. It's very relevant, very timely, and very important. I would, and this was a learning opportunity for me as well, and very enlightening. We understand that there is a recognition that the health is a very vulnerable sector to the climate impacts and very much exposed. But through this discussion, what I would quickly summarize, I see that Chris has mentioned about there are opportunities, or there are good news that we have heard from her, that there is a recognition that for a strong climate resilient health system, the importance of climate services cannot be ignored, and this is fundamental. And it's very much very important for a healthy society, which is the end goal for all of us. We come in this webinar from very different and various vantage point. And as we discussed, and as we see that at the end of the day, all our end goal is healthy society, and to ensure that that would lead to our institutional objective as well, to end poverty and shared prosperity. So it begins with that, and how we have discussed and we have learned how health is affecting a national development, and how climate change is impacting its be it from the disease factors, or be it impacting the whole disease ecology. And there is, the understanding is there that this is very important. However, what we have learned is, in terms of deeper research in individual country level, is still lacking. I think our colleague Stephen also mentioned about the vulnerability assessment and the economic assessment as well. Okay, there is a climate. We need to understand better how climate is affecting the population, or the different vulnerable groups. But also we need to understand the economic cost, as we are seeing how COVID-19 is not really only touching the health, human health. It is, the impact is vast across economies. So that need to really understood better. We heard from Joy about some good progress and good initiatives that has been carried out by WHO and WMO, and this is an opportunity we see that different initiative like SIF and World Bank and WHO and WMO, how we could work together better. Another takeaway for me is personally is I see that this is an issue that cannot be addressed with a single institution alone. It needs to be multidisciplinary. It needs to be the approach and the solution has to be integrated, and no one person cannot take it alone. So I heard a lot about the integrated research, combining climate information with health information, with economic information. So everything has to come together to really come up with the solution space has to address. And it was illuminating how Dr. Nicole also mentioned, we have seen an example what Chris, the discussion, what Chris started, like how climate change is, really affecting the disease vectors and changing the whole pattern and seasonality and all this. And we saw two examples in terms of the climate impact of dengue and the acute respiratory illness in Jamaica. I'm sure that this is it is not only a case in Jamaica. Other countries are facing the same issues, and these needs to be really understood better. I think our colleague Stephen also mentioned about 3 approaches, and we also learned from the banks how the bank is positioning itself to address climate risk, and what are the entry points and what are the opportunities for the health sector to work with other sectors and work within sector. That is in terms of increasing understanding, increasing, the analytical or evidence base, and also the policy support and the lending. How the 3 ways how the bank is working, and how we can collaborate with organizations such as WHO and WMO and other expert agencies. So that's I would like to conclude with this, that it is a discussion that we initiated, but this should not this can continue. This should continue, and I hope that everybody who participated in this event had some understood better or appreciated the conversation, and hope this is beneficial for our country counterparts as well, to see what are the range of solutions out there, and where are the opportunities lie for the next step. And also for our partner agencies, I hope that we all will reach out to each other and see how we can take the conversation further. And I would like to thank all the speakers again, and thank everybody for participating. Thanks, Laura, for wonderful moderation.
Thank you so much, Kazi. That's a very good summary, and thank you for sharing your thoughtful reflections on the presentation and the discussion. So I'm afraid we have to end this webinar very soon. We don't have much time. I know there are a lot of people who have also posted additional questions. We will be happy to reply to them through email. And once again, I would like to thank our distinguished speakers and panelists for the webinar, Dr. Chris, Professor Chris, Dr. Joy, Dr. Nicole, and Dr. Stephen. This is really a pleasure for us to have you and share with us your experiences in this field of health and climate change. And with that, I would also like to also take this opportunity to thank the PPCR team, Hannah Schweitzer and Shan Fulu. This would not have been possible without their great work and support. And also to Kazi and her team for collaborating with us in this very important webinar. Thank you. And I see a lot of PPCR friends and colleagues here as participants. I'm glad to see everybody participated in the call. Thank you so much, and have a good day. Stay safe and healthy.
Thank you, Lori, for all your efforts.
Yeah. Bye-bye.
Bye-bye. Dora, how are you, Dora?
Thanks, everybody. Bye-bye.
Bye, everyone.
Good to hear you. I'm well.